If you follow the news, then you may have heard the President and Secretary Kennedy talk about a potential link between the consumption of Tylenol during pregnancy and autism. And this has been met with a bit of criticism because some data show that there is a possible correlation there. Others say there might not be. But I think it's important to understand this. We have, of course, a tremendous rise in the diagnosis of autism in this country. It's been skyrocketing, and it's a huge concern, in my opinion, because this is a very debilitating condition that can significantly impact the individual and the family, of course. And investigating what causes this increase is, of course, extremely important. Now, the criticism, of course, comes in as well, because until recently, Tylenol was really the only thing that pregnant women could take sort of safely, or what we thought was safe, to treat, for example, a headache or a fever, which certainly can occur during pregnancy. Other non-steroidal anti-inflammatories and so on were not really good here because they caused significant side effects that we did not want for a developing baby. So taking away Tylenol here really leaves pregnant women without any medication really in those situations. It's, of course, very frustrating. Also, of course, this has been recommended for years and years from OBGYNs and other medical professionals. And sort of, going back on this right now is difficult as well. It's always difficult to admit, hey, maybe this is something that's not safe for you. So I don't know from the data we've seen that we can conclusively say that this is absolutely linked, but there's certainly a concern and there's a flag here. And what I would want to refer you here, and I want to really plug this, is a video from Dr. Roger Schultz, which I think really summarizes this extremely well. And he gives some at least understanding of how this could be related and what the mechanism of action could be. And understanding that, at least we have some background. Now, he doesn't conclusively say, this is absolutely true and this is the data, but he's saying, look, here's a possible mechanism of how this could happen. And here is another thing that we could do in order to mitigate this a bit. And this is actually very interesting. So the video by Dr. Schultz is titled Tylenol and Autism, Oxidative Stress and Sunlight. And he explains in there very well, and I really encourage you to watch the video. I'm going to put a link in here. The video explains extremely well the mechanism by which Tylenol may cause actually oxidative stress in the body. And that's from normal consumption of Tylenol. Tylenol is broken down, and there is a toxic metabolite that forms. It's about 5 to 9% of the breakdown products of Tylenol becomes this toxic particle. And it's usually then broken down by glutathione, which is an antioxidant that our own body makes and has in order to neutralize this. However, if this pathway is not working so well because we have a lack of glutathione, then there certainly could be problems. And oxidative stress is linked actually to the development of autism. So again, here's a causative possible mechanism why the consumption of Tylenol, especially chronic consumption of Tylenol and higher doses of it, might lead to oxidative stress. And again, oxidative stress is linked to development of autism. Again, at no point does Dr. Schultz say, here, this is absolutely true, here is the study, here's the proof. No, but he explains that there is a plausible mechanism that at least we should look at, because we certainly have this rising incidence of autism, and this could be one of the factors contributing here. So what Dr. Schultz describes very well here is, as we have this buildup of these toxic metabolites and we may not sufficiently neutralize them, we have this oxidative stress in our cells. And again, lack of glutathione is contributing here, or we use up all the glutathione, and therefore this oxidative stress cannot be neutralized. However, there's another antioxidant that's even more powerful than glutathione, which is melatonin. And I know we always think of melatonin in terms of sleep, but here it talks about it in the context of being an antioxidant inside our cells. So the melatonin we think of for sleep is in the pineal gland in our brain. It's released at night to help us sleep. It goes into the bloodstream to help us sleep. That is something that's, of course, very, very important. But here we're talking about intracellular melatonin production in the mitochondria specifically. And this is stimulated, the production of this melatonin, through sunlight, specifically through near-infrared light. That's about 54% of the spectrum of sunlight. This is something that is not within the visible spectrum, but we perceive it as warmth. When you're outside, even wearing clothing, you feel the warmth of the sun. That's actually near-infrared light. Again, 54% of the sun's radiation. So this is extremely important, and we're having less and less of this available, and he gets to this in his talk. But one way that we could mitigate this increased oxidative stress that we have from Tylenol exposure could be that we have more melatonin available to neutralize these free radicals that are formed. And that certainly could be something that could be preventive in this case as well. He's not advertising, take a Tylenol and go into sunlight, but we have less melatonin. So again, this is another mechanism that we have to neutralize free radicals, because we don't have enough exposure to sunlight. We're also shielding ourselves from near-infrared radiation by virtue of having LED light bulbs in our houses, for example, and also we have low energy glass. which does not let near-infrared light in. Remember, this causes warmth. We want to cool our houses. We have air conditioning. We want our houses to be energy efficient. And one way to do that is to have window panels that do not allow near-infrared light to penetrate through. So one, we don't get enough exposure because we're not enough outside, and we spend significantly less time outside today than we did about 100 years ago, for sure. Secondly, we're shielding ourselves from near-infrared light by having low-energy glass in our houses. And then thirdly, the amount that we get from our light bulbs, the incandescent light bulbs, will generate some near-infrared light, which actually was good for us. Now we replace that with LEDs, which do not generally do that. They can be engineered to do so, but then of course they would have a higher energy consumption, which we don't want. We want low energy consumption. So here again, he's giving this whole picture of why today, again, especially then if you take a medication like Tylenol, you increase oxidative stress. So that is fairly well known. It might not be sufficiently broken down by a glutathione system, and then the oxidative stress could be broken down further by an antioxidant, which is melatonin, which we may not have enough of either, and that's because of our lack of sunlight exposure. So again, at no point in here is he saying, yes, this is a causative result here. However, he's saying, yes, it's possible that the increased oxidative stress contributes to development of neurocognitive disorders, including autism. And we don't have enough mechanisms to neutralize. It's very complicated. I apologize for that. But I'm linking the talks. I think this is very interesting to watch. We certainly need more studies. Yes, this might not be completely definitive, but I would agree with the President and Secretary Kennedy here to point this out, because if we have even preliminary data that say, hey, there might be a connection, and we really want to find out what can we do to mitigate this crazy rise in autism, this would be possibly one of the factors that we can control. One, by being very careful of how much Tylenol a pregnant woman consumes during a pregnancy, obviously, because we know of the ramifications now. And this is chronically taking it or taking high doses. Both are very concerning, it seems, at least, right? Again, we don't have definitive data yet, but this is something that we should be educating the general population about, because there may be some women who take Tylenol because they've been told it's safe and they take very high amounts they might not even need. Another thing to keep in mind is, we jump to take Tylenol before anything else. Having headaches, other things can be done. Even cold compresses could be very helpful. Resting in a darkened room, these are all things we can do first. There's other non-pharmacologic things that we can do to help with the headache, for example. We also might not always want to treat fevers very aggressively. If it's a mild fever, a lot of times, again, if there's some infection we have, bacterial viral infection, a fever actually is something that the body does to help get rid of the infection. And just using Tylenol immediately at a very slight elevation of temperature might not always be necessary. Again, this is not medical advice, of course. You should always talk to your OBGYN, specifically when you're pregnant, to find out what they recommend in what situation. But, these are all things we should keep in mind. There are some natural remedies for headaches and even mild fevers, but we might not have to jump to medications like Tylenol. So again, I think it's very interesting to at least explore these options. I think it's misguided to just say, oh, this is terrible, Tylenol is absolutely safe. And of course, all the drug reps are coming out now and bashing this. No, look, we have an issue. This is a plausible mechanism. We need to investigate if this is something actually that is causative, but there's certainly a very good correlation here. And I think until we know more, we should warn the population, say, be cautious with this medication. I don't see any problem with that. And we certainly need more studies going forward to investigate this. But again, strongly encourage you to watch Dr. Schultz videos. Very informative, very technical, but I think gives you very good insight in the possibility of these links.